It's very difficult to hear the word cancer. My mother and I were walking down the street and we got a phone call from my oncologist, and she said it was stage 4. It was absolutely devastating. One of the hardest days that I've ever been through. The two of us started crying, and it was raining, and I felt like the whole world was crying right along with us.
That moment when I was first told that I had cancer, I was like, wow, this can't be happening to me. You think about your family and all the things that you dreamed about, and then you become frightened. The doctor was focusing on the tumor, but not on the patient, and I could feel that.
It's like time froze. Everything got really quiet. I didn't know what to do. I didn't know what it meant for me in my life. Is my health insurance good enough to cover this? How much work do I need to miss? Will I keep my job? And so all these unknowns were flowing through my mind and causing a lot of stress and anxiety.
I never imagined I'd get breast cancer. Was it difficult to hear? Absolutely. I never cried, but I was very angry and I was very fearful. It was a couple of months before my daughter's wedding, and I kind of felt I wasn't going to be alive for it. You want your life back. So I just got ready for the fight.
We know that when patients are told they have cancer, it's going to be jarring, it's going to be alarming, it's going to invert their world.
They are so vulnerable because, quite honestly, their life is on the line.
One would expect an entire system to snap into place that would ensure that this patient receives all the treatments that he or she needs. That is not the way that our system works. We have the most highly trained oncologists, but because we don't have coordination among all these clinicians, this care doesn't serve patients well. Sometimes it can even harm patients.
We have a culture that says the more we do and the more complicated it is, it must be better. We have ignored the reality of what is happening around us.
We've had great scientific advances and we can give great targeted therapies, and all of this is extremely costly, and nobody knows this up front.
Patients start making decisions which are terrible trade-offs, like, do I pay for this treatment that the doctor says will work, or do I pay for my grocery bill?
And so that's really where the urgency comes in. 1, the cost of cancer care, but 2, the number of individuals who are going to need this care.
A major shakeup is necessary.
It's really not a matter of do we need to fix it. The real question is, how can we fix it?
And if we don't get it right, we're going to just break the bank.
We will outstrip the resources for cancer care and frankly bankrupt the healthcare system.